Another group of GIT drugs that we are going to discuss are the emetics and the antiemetics. There are two main areas in the brain that are important for the physiology of emesis. The first is the vomiting center or the emetic center, and the second is the CTZ or the CRTZ, the chemoreceptor trigger zone. The vomiting center or the emetic center is located at the fourth ventricle of the brain, while the CTZ is located at the floor of the fourth ventricle. The main function of the CRTZ or the CTZ is that it contains receptors that detect emetic agents in the blood and relays the information to the vomiting center, which is responsible for inducing the vomiting reflex. There are different receptors or there are different neurotransmitters that are important for emesis. We have the acetylcholine and the substance P. These two neurotransmitters will act on the emetic or the vomiting center that are located in the fourth ventricle. Acetylcholine will bind to the muscarinic receptor, M1 receptor on the emetic center, and the substance P will bind to the NK1 or the neurokinin receptors that are also located on the emetic center. For the CTZ or the CRTZ, chemoreceptor trigger zone, it is stimulated by dopamine, alpha-2 adrenergic drugs, serotonin, acetylcholine, enkephalines, and histamine. Of course, dopamine will bind to the D2 receptors that are located in the CRTZ. Alpha-2 adrenergic drugs will bind to the NE receptors. Serotonin will bind to the serotonin receptor, the 5-HT receptors. Acetylcholine will bind to the M1 receptors. Enkephalines as well as histamine will bind to the H1 and the H2 receptors. All of these receptors are located at the CRTZ, the chemoreceptor trigger zone. There are two pathways for the induction of the vomiting reflex. The first is the humoral pathway, and the second is the neural pathway. For the humoral pathway, vomiting is initiated through the activation of the chemoreceptor trigger zone by blood-borne substances. Example, we have the apomorphine, uremic toxins, hepatotoxins, and the endotoxins. We also have motion. Motion will be detected by the oculovestibular system in dogs, and it will be detected by the chemoreceptor trigger zone. Another is the neural pathway. The vomiting is initiated through the activation of the emetic center by vagus sympathetic chemoreceptor trigger zone, nucleus tractus solitarius or the NTS, vestibular or the cerebrocortical neurons. So the stimulus, for example, from the GIT, the stimulus from the oculovestibular system, and the other system in the body will be detected through the emetic center. When do we use emetic drugs? Emetic drugs are usually administered in emergency situations after ingestion of a toxin. They generally remove less than 80% of the stomach contents. The most reliable emetic drugs will act centrally to stimulate the vomiting center, either directly or via the CRTZ. Emetic drugs are used in the treatment of poisonings and drug overdoses. So one of the contraindication of the use of the emetic drugs is that they are not to be used for caustic agent poisoning. So when we say caustic agents, these are strong acids and alkalis now that when ingested, burn the upper GIT tissues, sometimes resulting in esophageal or gastric perforation. So that is a contraindication of the use of the emetic drugs. The first emetic drug that we are going to discuss is the apomorphine. So what is apomorphine? Apomorphine is an opioid drug that acts as a potent central dopamine agonist to directly stimulate the CRTZ. So a while ago, we have enumerated the different kinds of neurotransmitters that are important for the induction of the vomiting reflex. And one of that is dopamine. Dopamine will, of course, act on the dopamine receptors to stimulate emesis. Now, that is present, the receptors are present in the CRTZ. So take note that um, apomorphine is a morphine-like derivative. It is an opioid drug, but unlike morphine, no, it is not used in veterinary medicine to alleviate pain. And of course, the primary function of apomorphine is to induce vomiting. The medication is chiefly used in dogs, and this is considered to be less effective, no, in cats than in dogs, no, because again the D2 dopamine receptors that are located in the CRTZ are are more responsive, no, in mediating humoral emesis in dogs than in cats. So again, for the classification of apomorphine, it is an opioid drug. It is also a D2, the dopamine receptor antagonist, or rather agonist. It is a dopamine receptor agonist, particularly on the D2 receptor. It can be administered per os, IV, or SC, and the IM route is not as effective. It can also be applied to conjunctival and gingival membranes. So again, this is now the classification of our apomorphine. It is an opioid drug. It is a potent central dopamine agonist. Now it is an agonist of the D2 receptors at the CRTZ, and it is considered to be more effective in dogs than in cats because the D2 receptor in the CRTC is more responsive in dogs than in cats. Although apomorphine directly stimulates the CRTZ, it has a depressant effect on the emetic center. Therefore, if the first dose does not induce emesis, additional doses are not helpful. No, this is for apomorphine. Excitement that results from apomorphine in cats now can be treated with the opioid antagonist naloxone. So this is the reversal agent now of apomorphine in cats. Emetic drug aside from apomorphine is xylazine. Xylazine is classified as an alpha-2 adrenergic agonist that is used primarily for its sedative and analgesic action. It is a reliable emetic in cats than in dogs. And of course, it stimulates now the CRTZ, the alpha-2 receptors that are located in the CRTZ. Xylazine is considered to be the first alpha-2 agonist sedative to be widely used in veterinary medicine. And yeah, of course, in veterinary medicine, it is mainly used as a sedative, analgesic, and a muscle relaxant. Because xylazine can produce profound sedation and hypotension, animals should be closely monitored after administration. So these are the two major groups of drugs under the emetic drugs that are used in veterinary medicine. We have the apomorphine and the xylazine. Apomorphine is considered to be an opioid drug. It is a morphine-like derivative. It is a D2 dopamine receptor agonist. Apomorphine and xylazine both acts on the CRTC to induce vomiting. Apomorphine is the emetic choice for dogs. Xylazine is the considered as the emetic of choice for cats. For the brand name of xylazine, this includes Rampoon, Gemini, and Anacet. The MOA of xylazine is that of course, it has an agonistic effect, or it stimulates the alpha-2 adrenergic receptors that are located in the CRTZ. So it is classified as an alpha-2 adrenergic agonist. This is xylazine. The brand name is Anacet. This is mainly used for dogs and cats as a sedative and analgesic. Another emetic drug is the Epico Syrup. And the Epico Syrup is made from roots and rhizomes of plants. And we have two alkaloids. We have the emethine and cephalin. It centrally acts to stimulate the CRTC. And also, it can cause irritation to the gastric mucosa. So it is said that the syrup of Epicoc is no longer recommended for home use in people or animals. Another group of drugs are the antiemetic agents. So it is important to note that vomiting is a coordinated effort of the GIT, musculoskeletal, and the nervous systems that aims to expel food, fluid, or debris from the GIT. The act of vomiting is controlled by the vomiting center in the medulla of the brainstem. So of course, we also have the CRTZ or the chemoreceptor trigger zone that is important in the vomiting reflex. Aside from acetylcholine, which is the major neurotransmitter in the vomiting center, we also have other neurotransmitters that we have mentioned earlier. We have, for example, we have the histamine, enkephalin, dopamine, um, dopamine, and the other types of neurotransmitters that are present in the CNS. These are the different types of antiemetic drugs. Now we have the phenothiazine derivatives, the antihistamines, the anticholinergics, the procainamide derivatives, the serotonin receptor antagonist, and the neurokinin 1 receptor antagonist. So these are the sites and the neurotransmitters that mediate vomiting. We also have the sites of action of the antiemetic drugs. So for example, in the CRTZ, we have, for example, the phenothiazines, the serotonin receptor antagonist, procainamide derivatives, as well as the NK1 receptor antagonist. So other sites are located peripherally. We have those drugs that are also antiemetics now that will act peripherally. We have the anticholinergic, serotonin receptor antagonist, and others. So the first group of drugs that we are going to discuss are the phenothiazine derivatives. So when we say phenothiazine derivatives, take note that this includes acepromazine and chlorpromazine. For their MOA, this group of drugs works by inhibiting dopamine in the CRTZ, thus decreasing the stimulation to vomit. So again, this group of drugs are classified as dopamine receptor antagonist. They are, of course, they are considered to be as sedative drugs. That's why for their side effects, since they are depressant drugs, and CNS depressant drugs, they can induce hypotension and sedation. They are contraindicated in cases of abnormal GIT motility because it may promote ill use and worsen vomiting. Another group of drugs that are antiemetics are the antihistamines. So the antihistamines are used to control vomiting in small animals when the vomiting is due to motion sickness, vaccine reactions, or inner ear problems. They work by blocking the input from the vestibular system to the CRTC. So this is the main MOA of the antihistamines as antiemetic drugs. So they can also cause sedation. The the group of drugs or the group of antihistaminic drugs that are classified as antiemetics are the H1 antihistamines. So we have for example, we have the trimethylbenzamide, dimenhydrinate, diphenhydramine, and tameclizine. So it is important to note that histamine, H1, and H2 receptors are found in the CRTZ of dogs, but not in cats. Histamine is potent emetic in dogs, but not in cats. And H1 antagonists, such as diphenhydramine, are ineffective for motion sickness in cats. So another group of drugs that are classified as antiemetics are the anticholinergic drugs. So of course, when we say anticholinergic drugs, these are the drugs that will mimic the action of the sympathetic nervous system. Anticholinergic drugs will block acetylcholine peripherally, which decreases intestinal motility and secretions. So for the contraindications of this drug, so this includes the presence of glaucoma or pyloric obstruction. Examples of anticholinergics are the atropine. So atropine is considered to be a mix, now M1 and M2 antagonist, and again it inhibits motion sickness in cats. This is because the M1 receptors are found in the vestibular apparatus of cats. So the anticholinergic drugs will not only act peripherally, but it can also act centrally, because it can block the acetylcholine receptors in the vestibular center and within the brain to prevent nausea-inducing stimuli to the CRTZ and the vomiting center. Another group of drugs that is classified as an antiemetic drug are the procainamide derivatives. And under this, we have the metoclopramide. For the MOA of the metoclopramide, it exerts its antiemetic effect via three mechanisms. The first mechanism is at low doses, it inhibits the dopaminergic transmission in the CNS. So it is considered to be a dopamine antagonist, a D2 dopamine receptor antagonist. Another mechanism is that at high doses, it inhibits serotonin receptors in the CRTC. So it is also classified as a serotonin receptor antagonist. Peripherally, metoclopramide increases gastric and upper duodenal emptying. So it is classified not only as an antiemetic but also as a prokinetic agent. So it simulates the GIT movement or peristalsis. Metoclopramide is useful antiemetic for dogs but not in cats, because CRTC dopamine 2 dopamine receptors are not very important in mediating humoral emesis in cats. Metoclopramide is less effective in cats than in dogs. So metoclopramide is indicated as an antiemetic in dogs principally. So again, as a summary, the metoclopramide again is it can act centrally and peripherally. Centrally, it can block the dopamine receptor and also the serotonin receptor. Peripherally, it can speed up gastric emptying. And because of that, it is classified as both antiemetic and prokinetic agent. Drugs are the serotonin receptor antagonist. Serotonin receptor antagonist works selectively on the 5-HT3 receptors located peripherally on the nerve terminals of the vagus nerve and centrally located in the CRTZ. Blocking the release of serotonin from these sites controls vomiting. So again, we have earlier said that serotonin is an important neurotransmitter to induce emesis uh, in the CRTZ. So when we are going to block this receptor, the serotonin receptor, of course, the serotonin won't be able to bind to the serotonin receptor, which is responsible for emesis. Examples of the serotonin receptor antagonist are the ondansetron, dulasetron, and the granesetron. So another group of antiemetic drugs are the neurokinin or the NK1 receptor antagonist. So they work on the NK1 receptors, which are located in the vomiting center of the brain. These drugs work by inhibiting the substance P. Take note that substance P is the key neurotransmitter involved in vomiting. So there are various neurotransmitters in the brain that will induce vomiting through the emetic center, and one of that is the substance P. So when the substance P will bind to the NK1 receptors, uh, which are found in the emetic center and also in the gut, it will induce emesis and of course, the presence of the maropitan citrate, which is an NK1 receptor antagonist, will induce a potent antiemetic activity. So maropitan citrate is used to prevent acute vomiting as well as motion sickness. And these are considered to be a potent antiemetics in both dogs and cats with a broad spectrum of activity against a variety of emetic stimuli. So again, because it acts centrally and also peripherally.